Everyone, welcome to Virtua Health's RealTalk Women's Health Chat. I'm Nicole Michalik from 92.5 XTU, and I am thrilled to be your host for tonight's event. I've been doing a couple of these. They're so amazing and beneficial and special, and thank you for joining, and I think you're just going to love it so much. So, a few helpful hints. Before we start tonight's session, your camera and microphone are turned off, but you can still ask our panelists questions through the Q&A tab. You can choose to submit questions anonymously, and our experts will answer your questions toward the end of the session. A number of you have already submitted excellent questions for our experts when you registered, and we'll incorporate many of them into the discussion. So I know you're probably like, I want this answered. It will happen throughout the hour. So if you prefer to have closed captions on, just click on the live transcript button at the bottom of your Zoom screen and then select show subtitles. You can see in this yellow arrow. You can adjust the size of the font by clicking on the subtitle settings. You should then see the closed captions at the bottom of your screen. Okay, so let's jump into it. I am so pleased to introduce two experts and incredible women for tonight's session: cardiologist, Dr. Agunbiade, and pulmonologist, Dr. Vagadia. So I've been practicing your amazing last names. So it's just amazing how incredible these two women are and that they're dedicating your time today. And I'm really excited to tell you more about them. So she received her medical degree from Harvard Medical School and completed her fellowships in cardiovascular disease and advanced heart failure and transplant at Johns Hopkins University Hospital. In her spare time, Dr. Agunbiade loves to hang out with her husband and her 3 kids. Dr. Vagadia is a board certified pulmonary critical care and sleep physician at Virtua. So she does sleep and pulmonary, which is amazing. And I know people are going to have a lot of questions on that. And she has interest in sleep medicine and sleep apnea. And I know there's a lot of questions about that. She went to New York College of Osteopathic Medicine for her medical degree. She completed a fellowship in pulmonary and critical care medicine, as well as a fellowship in sleep medicine at Tufts University Medical Center in Boston. I mean, talk about smart. She enjoys spending time with her husband and her 2 children and cheering on the New England Patriots. That's okay. At least we beat you once. At least
you did. Yes.
Yeah. And listen, I totally respect. I want the Eagles to be like, I want them to win 900 titles too. So welcome everyone. Okay.
Thank you.
So before we get into heart health, let's talk about the connection between sleep and overall health, because I think this is a good way to start. It's kind of a good overview. So generally getting the right amount of sleep leads to good health. But if you could maybe expand a little bit more why it's important, right? We talk about a better immune system. We talk about a brighter mood, energy levels. If you could just both speak from your expert level on why a good night's sleep is so important, how it helps these other facets.
I mean, I can start by, obviously sleep, we see all the time how important that is just in terms of how you feel in the morning. You know, when you get a good night of sleep versus a night when you've had a poor night of sleep or just slept 3 or 4 hours, think about the kind of, your mental alertness, how you make decisions, how you function through your day. I think those are sort of the things I think about from a head point of view. When you talk about the rest of your body in terms of the stress levels that may create by not getting a good night of sleep and the effects that can lead in terms of heart health and your overall body and well-being, never mind your ability to fight infections. And you touched on that a little bit in terms of your immune system not being up to speed to be able to deal with all the viruses, the viral insults of this past season, which I'm sure that many of you have dealt with.
The triple threat viruses, it's crazy.
Yes. So your immune system is extremely important for that. And then, you want to make sure that your sleep is not being caused by any other sleep disorders. And we'll obviously talk about that through this talk and as we kind of proceed. But I think the biggest thing is, reducing your stress levels, which helps with diabetes management, cortisol levels, and leading to a better lifestyle. And I talk about cognition and mental functioning, your ability to handle, like I said, decision making and how you approach individuals. I think it's all tied together. And when you talk about your sleep.
You know what, I'm really excited about this panel too, because I think sometimes we live in a space, especially women, and you two are going to have so much to say on this. I mean, you have these incredible careers, but then you're also wives, you're also moms, where you're like, it's fine, sleep could come last. So can you just talk a little bit about, even as a woman, and prioritizing sleep, and just why that's so important before we kind of get into the nitty gritty?
Okay. So I think that when we think, just like Dr. Vagadia was saying, sleep is crucial to, I think, our daily function. And as women, as mothers, we really have full plates. And it's really hard, like you said, to prioritize one thing over the other. And I do think that sleep is the one that kind of gets thrown out first on the priority list. But as we'll talk about more today, good sleep, good quality sleep, adequate duration of sleep really has a lot of benefits for the body and as a whole, and particularly for cardiovascular health. And so I think that as we go through our busy days, we need to find a way to keep sleep as a priority, understanding that it will pay off in many ways during the day. We already heard about the benefits it has as far as cognition, but in the long run, it also has a lot of cardiovascular effects when we're not really investing as much as we should in our sleep.
Yeah. So let's get into it, and let's talk about sleep and heart health. You can continue on this, and then we're going to kind of pivot between like heart, and then we'll go to heart health to sleep apnea, but overall heart health, and just in regards to like stress and inflammation in your body. We're talking about the buildup of plaque, about your heart health and sleep. And if you can just elaborate on that a little bit, doctor, about why that's so crucial.
Yeah, thanks. It's really interesting. So for a long time, for example, the American Heart Association, they had the simple 7, these metrics that were recommended for us to be able to kind of gauge our heart health. And in 2022, they actually added another metric, which is sleep. And so it's now the essential 8. And they recommended that adults get 7 to 9 hours of sleep. And so even in that the American Heart Association has recognized the impact that adequate sleep, good quality of sleep can have on heart health. So when you think about what does it do? So we know that from the data we have in different studies that sleep is associated with high blood pressure or hypertension. So when you're not getting enough sleep, you're at increased risk of developing hypertension. And some of this comes from the fact that when you sleep, there is a nocturnal dip in your blood pressure. And so when you're not sleeping long enough, or you're not getting good quality sleep, you don't get the benefit of having that drop in your blood pressure overnight. And so we see that you're at higher risk of having higher blood pressure during the day.
You know what I think is really interesting too, and I kind of just noticed this, is that our bodies are wild, right? It's like these things that we don't really understand, but it's your body just works on this clock where it's supposed to go to sleep. But we live in this modern world where there's so many distractions that we could force ourselves not to sleep. And it's something as simple as, there's a reason scientifically, or whatever you call our bodies, that like it's supposed to sleep. So you have to look at it from like almost like a caveman time, you know what I mean? And realize that like we live in this modern world, and there's amazing things, like science is incredible, and there's so many things we learn in the modern world, but there's also things that our bodies are just naturally supposed to do to help it.
Yeah, and unfortunately, I think modern technology has not helped us in that way. I can't tell you how many of us are sitting at night, either watching TV, looking at our cell phone, going through Instagram or Facebook, and basically all of those things.
TikTok.
TikTok, yes, exactly. Unfortunately, all of that blue light really reduces our body's ability to produce melatonin when it should be. And so I actually tell patients, and I tell, even my family members, and I tell my friends, you need to shut all that stuff off, and you need to shut it off well an hour to 2 hours beforehand. So you're already starting to channel into this frame of mind that your body is ready to shut down. You need to turn off all those bright lights, all those LEDs that we now have in our household. Start to get into a natural environment that's going to induce sleep. And I think we're not used to that as a society now, because everything's later and later, and we have all this, like these devices that allow us to prolong that. And it's really, like you said, stepping back into that caveman and saying we need to get rid of all of that stimulation to make our bodies get into the correct circadian rhythm, so that we do go to sleep when the sun goes down, the melatonin comes out, so that we can wake up after a good 6 to 8 hours of sleep, if not more, depending on your age.
Well, it's so fascinating too, because obviously television has been around for a long time, but to see how fast this other blue light technology has kind of been thrown at us in the last 20 years, really. And obviously you study science for a living, but I am curious in regards to sleep, like even children, right? Where like they're on iPads, or like there's all these different TV shows, and I'm assuming that has to affect just like your body and your brain, and how well you sleep. It's like the quality of sleep, I could imagine, is affected so much by the blue light.
No, I agree. And I think, as you were saying, I feel like everything is so much more accessible to us now.
Yes,
Before,
yes.
like we might have a TV in the living room, right? When we were growing up,
Yeah.
there might be a TV in the living room, and that's where you watch your TV, and then you go to bed. Nothing in the bedroom. But now you have your tablet. If you forget your tablet downstairs, you have your cell phone, right? That's if you don't have a laptop that's on the bed next to you. And it's not only adults that it affects, but it also affects the kids, like you're saying. So younger children need more sleep than adults do. And teenagers in particular, I feel, are a group that's at risk, because they're always on social media late into the night, talking, texting, TikTok, like you said. And so I think that all of us in general as a community need to be really vigilant on prioritizing adequate sleep, not just for ourselves, but also for those in our household.
Yeah. Oh, I could talk
Yeah.
about this forever. It's fascinating.
Well, I think the point about, how you said affecting quality of sleep is really important. And I think that I get told all the time, well, the TV helps me get to sleep. I need that noise, or that in the background, to make sure that I'm able to sleep through the night. Because if you turn off the TV, I'm actually awake. What I try to tell, individuals and patients is that, unfortunately, sleep architecture and REM versus non-REM sleep is really important. And the more that you leave on those lights and the TV, it's hard to get into that deep sleep, because your brain is still hearing the noises and that light is flashing. So it is really important to still turn it off, even when it's in the bedroom, and take away all those distractions.
Before we pivot to sleep apnea, how do you guys feel about like the white noise and the sound machine and stuff?
I think that they can be beneficial for some. I think at the end of the day, the goal is to get to sleep. And so if it's going to help you get to sleep and stay asleep, then I think it's good. And if it's going to be more of a distraction for you, then it's obviously not the best method for you to get to sleep and stay asleep.
Yes.
Right.
I prefer timers on that type of stuff if you can. Sometimes if it takes out other distractions, the dog barking, people opening and closing the door, then those sound machines are helpful. Just like for our kids, you can turn them on outside the door. However, I do, for other music and other devices, really try to put that on a timer so that it shuts off after about 30 minutes.
Yeah. Yeah, growing up, I'm from near the Poconos, and my parents had like window units, and there's nothing like the hum of a window unit air conditioned. Like sleeping like a baby. Like, do they have that on Spotify? There's some really great questions coming in, but obviously we have to talk about sleep apnea, right? It seems now, my observation seems like it's becoming more common. I'm not sure if that's true, or if it's just the fact that we have so many ways to consume information. It seems like it's becoming more common. So can we talk about sleep apnea, how you can kind of be aware that you may or your loved one have it, what some symptoms are, and then talk about, there's obviously the CPAP machine, which a lot of people talk about, but then there's Inspire, which is this new implantation device that's kind of like a hot topic right now?
Yeah, I guess I'll take this one. Sleep apnea, and I always try to kind of share this there. The main type that we talk about is obstructive sleep apnea, where the airway is either narrowing or closing off completely during the course of the night. And gravity doesn't work in your favor, your muscles relax and they close off or can close off completely. And that's really what sleep apnea is. So I think it's fundamental to kind of know what happens when we're talking about sleep apnea. The symptoms, though, are not going to be necessarily all of those sleep interruptions. It may be simple, vague symptoms, everything from just feeling tired and fatigued during the day. Some people have the traditional snoring, choking, gasping, and they know that they're, having one of these obstructive events. It could be as simple as mood and irritability, increased depressive symptoms, dry mouth, even reflux has been associated with it. So I think that increased urination at night, some people think, oh, I wake up to urinate a lot of times. That's not sleep apnea. It's just because my bladder's full. No, sometimes we wake up and then we have to urinate. And also there's a hormone that can be released that causes us to wake up at night to also increase the urination. So I think that all those symptoms can be part of sleep apnea. And I think that anybody who has trouble sleeping at night should definitely be evaluated for sleep apnea, as well as some of the other disorders that may disrupt sleep.
And does sleep apnea, traditionally, a lot of people think obesity or being overweight is there, can you be quote unquote normal size or normal weight and still suffer from sleep apnea?
Absolutely.
Yeah.
Yeah. So that's really good for people to know, because they're like, oh, well, I have I'm quote unquote normal weight, but they could still suffer from it.
Yeah, absolutely. And I don't think that I think we do a better job in terms of diagnosis and identification because the public has become more aware about sleep apnea. But I think obesity is an epidemic, and we talk about that and obviously how that affects, overall health. And that's why I think we tend to see more diagnosis now. Certainly, there are different treatment options. We talk about everything from, you mentioned CPAP, which nobody wants to use and says, hey, listen, the mask with the machine, I definitely can't, I can't have trouble sleeping. How can I possibly sleep with that? But I say, listen, you're no different today than you were before you had a CPAP. So it's best to try it and see whether it helps you or not, because the effects, medical effects and heart health effects from that are tremendous. The other thing I sort of mentioned, you kind of brought up, was about the new Inspire device. And that device obviously replaces CPAP in certain individuals. So you have to be screened to be the right individual. And you also have to have tried CPAP. So I strongly encourage, first the diagnosis of sleep apnea, trying the CPAP, and then talking about the Inspire device, which is really an implanted device that innervates the hypoglossal nerve that helps to pull some of those soft tissue oral structures forward.
Why do people have sleep apnea? Do we know this? Like, is it genetic? Is there a reason some people get it and some people don't?
Genetics plays a part, right? Facial structure. So how your oropharynx is created. So if your parents have it, siblings have it, you have the same face, I'd say likely you may have it. And two, weight, right? So how much these fat pads and how your airway is and how obstructive you are depends a lot, unfortunately, also on weight.
Yeah, it's very interesting. How about restless leg syndrome and insomnia in general, right? A lot of women talk about restless leg syndrome. And then obviously so many people suffer from quote unquote insomnia. And is the general term insomnia actually the diagnosis, or do things cause insomnia? I know that it's a kind of a loaded question for both of you, but
insomnia is a very complicated topic. And really, it takes a 60 to 70-minute evaluation to really go through true insomnia, because insomnia is really a symptom of could be any potential causes of sleep disruption, whether that's trouble either getting to sleep, trouble staying asleep, or a combination of both. So I think it's really identifying where the sleep issue is, or if it's, like I said, mainly just related to being able to get to sleep, being able to stay asleep. You touched a little bit on restless legs, and certainly that's more, a clinical diagnosis based on what type of symptoms it may be having, like this urge to walk around or move their legs. They notice that it typically happens at night. They notice that when you walk around, the symptoms actually get better. So those are all really part of the classic symptom of true restless legs. You can pick up periodic limb movements on a sleep study. So some patients may not have that much in terms of restless legs, but they'll find that on a sleep study that they have periodic limb movement disorder, which looks at limb movements that may be happening at night and causing interruptions to your sleep. So if you are having insomnia, then sleep apnea is a possibility that could be contributing to that. Restless legs could be another cause of that. So insomnia is a result usually of other causes, is the best way that I put it. There is primary insomnia, but that's not, it certainly is something that needs to be worked out, and a thorough evaluation has to be done.
And as we're talking about, the different sleep conditions, and we spoke about insomnia, we spoke about obstructive sleep apnea, and we spoke about CPAP. And I think that is also important to remember that as we're talking about these problems, and they're very common in the community, it's really important to seek out the care for it, to be evaluated, to see if you're someone that snores a lot, if you're not getting good sleep, to actually go see your doctor and discuss it, to see what treatment options there could be. Simply because, there are many reasons, but part of it is because it does have a significant impact on your cardiovascular health, I would say, right? So for example, sleep apnea has been associated with atrial fibrillation, which is an irregular heart rhythm that some people can have. And we know that if someone has atrial fibrillation and you don't treat the sleep apnea, then it's more difficult to control. But if you do treat the sleep apnea, or AFib is actually better, more easily controlled. We also know that other conditions, such as heart failure, which is when the heart can be weak and it doesn't pump as well, has been linked to poor sleep, poor duration of sleep, and poor quality of sleep. Poor sleep has been associated with increased risk of strokes, and also with heart disease. There are studies that have shown that in people who don't get enough sleep and don't have good quality sleep, you actually have increased buildup of plaque in your blood vessels. And the development of that plaque is what increases your risk down the road of having a heart attack or developing more significant coronary disease. So as we're talking about all these things, it's really sleep, I feel like we said earlier, it doesn't get as much attention in our lives as it should, but there are actual medical conditions that are linked to getting better sleep, as far as having lower stress levels, decreased inflammation, and just a myriad of benefits that you can glean from better controlling this.
Yeah, it really is fascinating too, because I think so many people are like, it's okay, I can just get 4 hours of sleep a night, but then they don't feel good. So then they go to see, one of their doctors, and then all of a sudden you ask them, well, how much are you sleeping a night? And then, they're drinking coffee at 7 p.m. and they're staying up, to watch all their shows in their DVR. So here's a question for me too. We're going to talk about like tips for getting good night's sleep. And there's some really great questions coming in, but does the time you go to sleep matter? Does it matter if you go to bed at 9 versus 1 a.m. if you're still getting those 7 to 9 hours? And there was a really good question that I saw come in that talked about sleeping in shift, like 4 hours at a time. So 4 hours twice a day versus a solid 8 in one setting, which I thought was really interesting because I never really thought about that. I did morning radio for almost 8 years and I still have PTSD from it because I didn't sleep enough, because I would be at a concert and then all of a sudden I would wake up at 4:30 in the morning. And to me, the nap didn't matter at all. Like I was still miserable because I crave that, 7 to 9 hours. But medically, I'm curious if that matters.
I would say that consistency in the time that you go to sleep is important, because that's one of the things that will actually help develop good sleep habits. And so if you go to sleep at 10 o'clock at night and you're going to count out your 7 to 9 hours, that will put you at 5 a.m. or at 7 a.m., depending on how many hours you're trying to get. I don't know that it matters as much. I don't think it matters as much when you go to sleep, as long as you're consistent with the time that you go to sleep and you're getting the required number of hours of sleep. And then to answer the question of the breaking up your sleep, you want to have enough sleep to actually get into that REM sleep. And so if you're having shorter periods, you might not be able to actually tapping into that deeper sleep that's important for a good quality of sleep.
Yeah, that makes sense.
So, I think it all depends on your schedule, but I also recommend you keeping that schedule 7 days a week. People vary that schedule, and the weekends, they're like, well, during the weekdays, I'll go to sleep at 10, but on the weekends, I'll go to sleep at 1. The problem is when Monday morning rolls around, your body thinks that it's going to get to sleep in late. And so you sort of gyp yourself of those few hours where you may be getting a lot more REM restorative sleep. And so you start off the week almost sleep deprived. So I do recommend that cycle that you said, whatever that is, whether that's 1 to 9 o'clock, or whether that's 10 p.m. to 6 a.m., that you try to really maintain that consistency and not vary that by more than an hour if possible.
Yeah, it's hard too, because so many people, I've always had such a kind of a different schedule because of being on the radio. I did mornings, I do afternoons, I did middays, but most people do the quintessential 9 to 5. And a lot of people suffer from the Sunday scaries where like they almost like keep themselves up because they're like, I can't believe I got to go to work, but they're actually like doing themselves such a disservice by doing that.
Because you're starting the week with a deficit.
Yeah.
Yes.
You're not as sharp as you should be starting your work week.
No. And so that just, and you can't, there's not a way to just fix sleep debt. For example, you can't say, oh, I've missed such and such hours of sleep, I'll just catch up. It unfortunately doesn't work in the same way. So 2 plus 2 doesn't equal 4 in that case. So
we're on a 24-hour schedule and our body works in those 24 hours. So it doesn't know if you wait 4 days to try to catch up. It's like, well, no, you already missed me. Like, yeah. So before we get to the questions, let's just talk about first some tips for a better night's sleep. I feel like a lot of people know this. So maybe we could talk a little bit more like, what's one thing that's the most important to implement, right? Like, should you take a nap? Should you not take a nap? Like, obviously a dark room, we know the blue light's a no, but is there anything else that you think could really help people in those first couple steps to like kind of train their brain to do this sleep in the best way?
I think the cool, dark room, so temperature matters. I try to tell people don't leave your thermostat. It's just known that your body temperature needs to drop when you go to sleep. So if you try to match that or bring that down, I think that's helpful. Second, I said we talked a lot about the consistency of a routine, making sure that when you set up your routine to stick to the certain time and wake up time. You talked a little bit about naps. So I typically try to tell patients, especially ones that have trouble getting to sleep, avoid napping during the day. However, if you don't usually have any trouble getting to sleep, then a half-hour nap. I wouldn't do something more than that. If you've lost a lot of sleep, then up to an hour and a half nap, but nothing more than that. I would not take 2 or 3 hours. It will simply disrupt or delay your ability to get to sleep. And the last thing that I sort of say that I think is really helpful, and even for myself, is that I need a wind down period. I need time to sort of relax, whether that's, like listening to white noise, whether that's listening to music or reading something I've already read, something that's mundane, but also very calming. I think that getting your brain to shut off all the external stimulus is probably my best advice and tip, and finding that for yourself, or that one thing that may be helpful for you.
And I think also avoiding caffeine, right? Later in the day, alcohol, avoiding that late in the day also. And then, for those of us that are moms and have kids and we're busy, just like you said, the wind down time, right? So once the kids are in bed, you finish doing whatever tasks you have to do in the house, you finish cleaning up the kitchen, tidying up this room and that room in the house, to really give yourself that time. That's your time, right? When you can decompress for the day. And that decompression cannot be scrolling through Facebook. It's actually time to reflect, meditate, kind of create the environment that's conducive to actually generating good sleep. And then seeing that as something that you're investing in for yourself, right? To really invest in sleep.
I've been reading a lot about how this new kind of craze with moms is like sleep punishment, or I forget the exact term, but basically they're keeping themselves up because they didn't get time for themselves during the day. So like they're mad that they didn't get to enjoy. So they're staying up to like 1, 2 o'clock in the morning because they're like, I want to watch a show, or I want to read a book, or I want to scroll on TikTok, almost as like to be defiant, but really they're just hurting themselves. Like, listen, shout out to all the moms that are watching because my God, I mean, as my friends have kids and I'm just like, this is wild. Like being a mom is wild because I babysat my niece. She's 16 months and I stayed over to babysit her. And like, all I did was like, is she okay? Is she breathing? What happened to her? And I'm like, I'm just the aunt. I can't imagine when you're a mom. And then I'm like, she moved her foot. Is her foot stuck in the crib? Like, I felt like my sleep was screwed up for like 3 days after that. It was just one night. So I was like, what do these moms do in like real life when they have to like sleep with their kids at home every day?
I feel like I've been guilty of exactly what you described, right?
Yeah,
Where it's been a
me
busy
too.
day. I've been running after the kids and doing this and doing that, planning this event, and in the evening when I sit down and I should be doing my wind down period for the night, I'm like, no, this is my time that I can actually catch up on the fun stuff that I want to do, right? Facebook and so on. But then I always think about how I feel the next day.
Yeah.
Right? When I'm at work or I have things to do and my brain is just not as sharp and I'm dragging through the day. And then the short-term benefit that I got from being able to do that guilty pleasure of mine, it really does not pay me well the next day for an entire 24 hours.
Yeah. And it is crazy. Just personally, like I said, I did mornings, right? So I didn't, for almost 8 years, I didn't get significant sleep. And the way I would feel around like 2 or 3 o'clock in the afternoon, where you have that like heaviness. And I don't feel that because when you get 7 or 8 hours of sleep, you just go through the day. And then 9, 10 o'clock hits and you're like, oh, I'm tired. I'm ready for bed. But when you don't get that significant amount of sleep, like it's not even, it's just this like feeling of like, I can't even imagine going to the the grocery store right now because I just feel so blah. So it's just so important. All right, let's jump to the questions. And there's some really good ones. And I love to start with this melatonin, sleep aids, medicine.
Yeah.
Let's talk about that. And there's some funny ones in here too, because there's some really great questions. So let's start with the sleep aids, the melatonin, and then we'll kind of
So I get questions about sleep aids all the time, and people ask me from everything from, those melatonin gummies to cannabis gummies, and everything in between, valerian root. Sleep aids really should be used on a short-term as needed basis. And really it's more for acute insomnia. Some stressful event happened, you weren't able to get past it, and instead of perpetuating bad behavior, that's when you institute or start a sleep aid. The problem is that people become dependent on those sleep aids instead of actually fixing the problem that may have caused it, or addressing the real underlying cause. So I really say, if you're going to use melatonin, it should be for a short time. It should be for 1 or 2 days to get you past that episode. But once you become more dependent on them, no amount of sleep aids is really going to fix or cure insomnia. And that's the problem. Then you jump from melatonin gummies. Now you add valerian root, or you try, some chamomile herbal tea and then you start to jump into medications, and those medications, ideally from a long-term use perspective, has risk for dementia. It has risk for abuse over time. So I really try to tell patients, first is addressing what the real cause of the insomnia was, and then if you absolutely must use something, then it should be on an as needed short-term basis to get you past maybe an acute event.
And I think also developing the good sleep habits if you're using a sleep aid, right? So all the things we've already spoken about. So it's not just to take it and then go to sleep at 8 o'clock one night, 10 o'clock one night, 1 a.m. the next night, right? It's to say, okay, I'm going to use this. I'm going to pick, this is my bedtime. I'm going to do these things. I'm not going to drink alcohol. I'm not going to take caffeine after a certain time. I'm going to exercise early in the day. That will help kind of get me a bit more tired when it's time for bedtime. Take that walk early in the evening. Try to expend some energy so you're a bit more fatigued when it's time for bed. But if you're using the sleep aids, you should be doing it alongside developing a structure that's actually going to be sustainable moving forward.
Yeah. I remember growing up, I grew up in a really small town, and people used to always do like after dinner walks. It was like a thing, right? And then all of a sudden, like people don't do that anymore because there's just so much more to technology kind of ruined that. But I think it kind of gets you in that mode of like wind down. Correct. You'd like go on a walk and then you'd like watch Jeopardy, you know what I mean? Maybe Family Matters, and then time for bed, right? Like, It's just so interesting. So this is a really great question. How accurate are smartwatch sleep tracking devices regarding restorative mental, physical sleep? That's a lot of people love to watch, wear their watch, or they put their phone near their bed. So how accurate is that? Does it work? Does it matter?
Yeah, so I think modern technology has certainly helped. I have patients that come in that saw that their Fitbit or their smartwatch had picked up that they were waking up a number of times at night and said, maybe I should get this checked out. So I do think that there is some utility in it. Do I think is it replace a sleep study, or does it diagnose disorders? No, I think it just highlights what your sleep quality may or may not be like. I do think people need to, I see patients also look at their smartwatch or their Fitbit and they think, oh, I didn't get REM sleep through the whole night. I must, or they're looking for certain quota, which actually, the amount of REM sleep and the amount of non-REM sleep, your REM sleep is only a fraction of that, 20 to 25% at most. So I think it's also understanding what those numbers mean when you do have any smart technology.
But you can use it as a fact check to look back on your week, for example, and to see, okay, so how am I doing with getting enough sleep, right? So if it's tracking your sleep for you, you can look over the week, over the month, and see, am I getting enough hours of sleep? Do I need to make adjustments? So I think that's where it also can be helpful.
This is a really interesting question. I have troublesome dreams. I sleep 4 to 5 hours initially. After that, I fall asleep and experience disturbing dreams that I often cannot attribute to anything going on in my life. Is that like, do we need to go see a psychic?
Yeah. Well, I think there's a little bit to unpack in there. And what I mean by unpacking is, you need to take a look at medications. You need to look at how many hours of sleep they may be getting. We dream in both REM and non-REM sleep. I get that question a lot about, when are my dreams happening and what does that mean? I remember some. So it is normal to dream. It is normal to have recurrent dreams about different things. It often is based on what we may have stimulus during the day. Sometimes we can't always figure what that may be, or say, I didn't have anything to do with this. Certainly, I also like to see whether dreams certain come out, or if you act out your dreams, like sleepwalking, sleep talking. So those are the things that I kind of start to probe a little bit more to say, are your dreams causing any activity? And then you have to once again reevaluate sleep hygiene and see if any of those things may be provoking some of that.
Yeah. Here's another really great question. If you wake up earlier than your alarm, is it better to stay awake or to try to go back to sleep?
It depends how many hours of sleep you did get. Right. So if you slept 4 hours, I'd say get back to sleep. You probably need more. And that was an arousal that may have occurred. Early morning awakenings, I do tell people, though, can be a sign of sleep apnea. So if you do have a lot of early morning awakenings, then you may want to get that checked out. The other reason that people wake up, if they used to wake up at a certain time and their body is programmed to wake up at that time, then they wake up. And as long as you don't start to create bad behavior, and that is going to perpetuate you waking up at that time, then I try to just say, shut your alarm, or if you can go back to sleep and you haven't gotten enough hours of sleep, to go back to sleep.
Mm-hmm. Can you explain idiopathic hyperinsomnia?
It's a very specific question. So just like insomnia, there are disorders that are hypersomnia. And that's when, you may have heard of narcolepsy. So just like I tend to think of idiopathic hypersomnia as sometimes not just, it's people who are sleepier than expected during the day. The difference between idiopathic hypersomnia and narcolepsy, though, is that in narcolepsy, you're actually going into REM sleep when you're having those episodes of potential sleepiness during the day. Idiopathic hypersomnia, on the other hand, is you are sleepier than normal, but you don't go into that deep REM or REM sleep. So like I said, just like there is insomnia, there are people who require more sleep and that are more sleepy during the day.
Interesting. Mm-hmm. This says, this is amazing information. I work all different shifts, run with teenagers, and family history of heart disease. So obviously this is a big deal that I think a lot of people don't realize how much heart health and sleep go hand in hand. Mm-hmm. This says, does eating at night affect sleep?
It can. I tell people not to eat too close to bedtime or large meals too close to bedtime. Certainly you want to try to give yourself a couple hours before you're going to bed and eating. Sometimes sleeping on a full stomach can lead to reflux or other disruptions to sleep. Also, how we metabolize that food and how our insulin and our cortisol levels may get affected by that as well, our glucose levels. So that may be reasons to avoid eating a very large meal in particular close to bedtime.
Yeah, agreed. Because we know that if you're eating very high carb, like carb heavy meals towards the end of the night, then the way your body will be able to manage that, and your insulin levels will be affected. And we know that poor sleep, for example, in general, is associated with an increased risk. It was associated with diabetes, and with the way that the body is able to manage glucose and insulin resistance. So I think if you're going to eat late at night, it should be something light, but you should try to get your dinner in earlier, and then just have something light before you go to bed.
Yeah. We kind of talked about this earlier, but they might have jumped on a little later, but it says, what effect does undiagnosed and untreated obstructive sleep apnea have on the cardiovascular system?
So it has multiple effects. So one big one that I'm sure a lot of people hear about because it's on the news, on the TV, atrial fibrillation. So it's a common rhythm that it's an irregular heart rhythm that some people can have that can increase the risk of developing a stroke. And so we know that if you have about 50% of people with sleep apnea, AFib have sleep apnea. And so it's something that we screen for when we see patients, and something that we are very, we encourage people to get treated if we do diagnose it. And we, as I said, I think I said earlier, if you get someone out of atrial fibrillation, there are ways that we can kind of shock the heart to get it back in normal rhythm. If it's in that irregular rhythm, patients are more likely to stay in normal rhythm if we treat their sleep apnea. And then also hypertension. So whenever we're seeing people with difficult to control hypertension or high blood pressure, one of the things that we look for is whether they have obstructive sleep apnea, because as I said earlier, you don't necessarily benefit from the decrease in your blood pressure that we have overnight otherwise. It's also been associated with heart failure management. And so I think that there are, and also obesity, right? So I think that all these cardiovascular associations are there. And so we're really strong, we're really good proponents of getting it treated in cardiology.
Yes.
This is really great too. What can I do if I'm experiencing menopause and having problems falling and staying asleep?
Unfortunately, hormonal variations do have a very significant impact on sleep. There used to be hormone replacement therapy that would sometimes help with a lot of that hot flashes and other symptoms. I try to tell patients that the same things that we talk about in terms of meditation, trying to maintain a cool environment. But if you are having a significant amount of trouble getting to sleep and it's really affecting your quality of life, then to go back and readdress, maybe there is an option for hormone replacement therapy specifically for that reason. Though you have to understand the risks and benefits of doing that.
Virtua has an amazing gyno program and OBGYN.
Yep.
So we're all in one happy family. So definitely that we talked about this when we did that panel, but you know, menopause and hormones are such a real thing and people don't realize how much
Don't appreciate it. Yeah.
Yeah.
Another problem as a female.
Yeah. I mean, what else did we get? You know, oh my God. That's my theory, is that men were always jealous of women. And that's why that was always my thing from the beginning of time. They were jealous that women could give birth. So they were like,
Yes.
yeah, it was always a jealousy thing. Okay. So, I started CPAP last week. Can't sleep at all. How long do I give myself to adjust to trying to sleep? I hate the machine. Please help. I want to send it back and say, forget it.
That comes up more often than I think. You have to give it a couple of weeks. You know, it is no different than any other thing that you try, right? When you first try, it may take some getting used to. I also encourage the patient or the panel or, you know, whoever sent in that question, that they should go back and speak with their sleep physician, because sometimes the pressure on the machine may not be set right for them. And that may be helpful to do, you know, something called an in-lab titration, which allows you to see what the pressure is appropriate for them. Because most machines right now are sort of auto set machines. And so they vary based on, what the pressure that you might need. And I suspect if that's the case, that it may be beneficial to go back to the sleep lab and see if the right pressure is on the machine. And then you want to make sure there's no other causes or disruption to your sleep, that in addition to just, the CPAP machine. But it does take some getting used to. Sometimes I say start with the mask as opposed to the mask attached on with the machine. Half of the battle is making sure everything fits right, in addition to the pressures.
And there are different masks that you can use, right? Because I've definitely seen some
Yes.
patients have better success
Yeah,
with
I mean,
some
there's
masks
nasal
than others.
masks, there's
Yep.
full face masks, and you
Yep.
want to make sure that, the mask that you picked is something that's going to be effective for you. Because people think the small masks, the ones that
Yep.
sit underneath, those are, oh, wow, those are great. That's the one I want to try. But then they don't realize they're a mouth breather at night. And the whole thing is counterintuitive, because now you can't breathe at night because it's just going through your nose instead of
I'm
your
a
mouth.
mouth breather. I'm a mouth breather. I hate it. But my mom's a mouth breather. My Grammy was a mouth breather.
Yes.
Like, yeah, my doctor was like, sometimes it's just genetics. And I'm like, like, so
Yeah.
I
So,
was like, I'll Google like physical therapist for mouth breathing. And then
Oh my
like,
goodness.
like I try to but it's so annoying. And I never really
No.
realized it till a couple years ago when I was like with my mom and I'm like, oh, you're a mouth breather when you sleep too. It's yeah.
But there are so many benefits when it does work, right?
I know.
I've definitely seen patients, they come in, like just today, I saw a patient and he was like, yeah, I was like, oh, so you have CPAP now, you're using your CPAP. He's like, yes, I hate it. I was like, but how do you feel when you don't use it? He's like, yes, I see a difference. I feel better when I use it. So really, people do see the benefits.
Yeah.
So stick with it is what I would say.
This is really good, is because, and then another great question, but people are so used to like go and go, and we live in this environment where it's like go, right? Overstimulate. You have to try these things to make yourself feel better. You almost have to have like, quote unquote, like a little bit of self-discipline to say like, I'm going to put the phone away.
Yes.
So you can see how better you feel when you do it.
Yep.
You know what I mean? Like, I think that people have to realize that you can feel better. You just have to do it, and then all of a sudden they're like, oh, well, this is crazy. Like, you mean I stopped smoking and I felt better? Do you know what I mean? It's like, oh, go figure, right? So
yes,
sometimes it's hard though, leaving those habits behind. But so this is great. Busy work schedule, family schedule. If I have a choice of exercising later at night before going to bed or getting the extra hour of sleep, which is better for heart health?
Huh.
I'm going to say sleep because I'm a sleep physician.
And I'm thinking, well, if that's the only time you can get your exercise in, that also has its benefit,
That's a tough one.
I say, I think it's a tough one because I think that we have clear benefits for clear data showing the benefits of exercise, right, for cardiovascular health. So if that's the only time that you can fit your exercise in, it's going to be hard for me to say don't exercise. Yeah. But I would then say you should still try to get your 7 to 9 hours, right? So if it's going to be 7 hours versus the 9 hours, then maybe that's a reasonable compromise. But exercise is good. Sleep is also good. They're both part of the essential 8 for cardiovascular health. So I don't know, do you have different thoughts, Neha?
Well, yeah, I mean, actually, like you're right. If you're only getting 4 or 5 hours and exercising an hour, well, like that doesn't make sense.
Exactly.
But if you're going to get 7 instead of 9, then like that makes sense.
Yep.
Yes. So I think you need to sleep to be more efficient in your day. I think the less that you sleep, the less efficient that I've seen in my day, even speaking from personal experience, right? So, and I kind of brought that back to decision making, how you organize your tasks, how you organize, what's going on with your life, is that when I'm clear and I have gotten a good night of sleep, I'm just able to plan out my day better. And my hope is that if you are getting that extra sleep, that you're going to make, you're going to be able to fit that in somewhere so that you made your day more efficient. But you have to be willing to sort of say that this is a priority. And as moms and women, we just don't prioritize it, right? And that's why both of us are speaking about this, because we know how important that is.
Yeah. Shout out to Barbara. She said they are jealous because a mother always knows who are her children and her lineage. A man never knows. That's good, Barbara. Oh, wow. Okay, so, good one. How about mouth taping for sleep? That's a real hot thing right now on TikTok and Instagram.
Mouth taping.
Yes, mouth taping, you know.
Yeah, mouth taping.
You know, it doesn't fix sleep apnea, first of all. You know, I think it's this idea, like you said, that you're retraining yourself to breathe through your nose as having your mouth open and breathing through your mouth.
I'm
It
too
doesn't
scared to
fix.
do it because I'm stuffy sometimes, and I'm like, if I tape my mouth, I have allergies. Like, I just feel like I'll be suffocated.
Yeah, they think that it somehow changes how the airflow happens to push that airflow through the nose. I'm not, I mean, there is no, I have not seen any scientific evidence to suggest that mouth taping fixes any particular sleep disorder. Now, I may be wrong down the future and somebody's going to publish something about this, or somebody has already, but at least right now it seems to be more of a TikTok fad, and, you know, maybe retraining how airflow moves as opposed to actually fixing any sleep disorder.
Yeah, because there's companies that have special tape, and then a lot of people have been doing like the micro, like surgical tape, and you put like a little piece right here, and it's supposed to help. I'm too scared to do it.
It may help with snoring, and it may help, you know, sort of like I said, retraining how that airflow works. But when it comes to evaluating and fixing other sleep disorders, if it helps, you know, in terms of insomnia, then I'm all for improving quality of sleep. But just understand that it's not looking to actually fix anything medically.
Yeah. So there could be people who snore but don't necessarily have sleep apnea, right?
Yeah, so snoring, I tell people, happens anywhere from here to here. And the snoring that we worry about is the snoring that's happening here, right? That's causing or creating sleep apnea. Snoring here leads to a lot of noise and airflow resistance. So sometimes we'll do sleep studies for patients who are really snoring significantly at night, and we find out that they don't have clinically significant sleep apnea, but they have a ton of snoring. At which point then I do refer back to ENT for evaluation for a deviated septum, consider nasal sprays. But I also think that in those patients, that snoring sometimes can be very disruptive to sleep, right? So you're getting a lot of upper airway resistance that's creating noise and reverberations. So you may not be sleeping well simply because of the snoring. But yes, so not everybody who snores has sleep apnea, but people who do snore are obviously patients that should be screened for sleep apnea.
Right. What, so psych medications alter sleep and wake cycles. Is there any recommendations how to correct it? So I guess like depression or anxiety medication.
Yeah, and there's a catch-22 about that, because we do know that you need to control depression and anxiety, particularly to help with control and treatment of insomnia, because those are sort of some of the underlying risk factors that are going to cause and continue to create problems with insomnia long term. So unfortunately, a lot of the antidepressants can alter how we get amount of REM sleep. So I do think that it is a catch-22, that finding something that works in the right favor for you is important, in working with your sleep specialist and your psychiatrist to kind of find a balance between that. Because if you don't fix one, it creates trouble with the other, and vice versa. But it's just trying to find the right medications for you. So I can't, you know, give off the cuff and say this is the best medication for you know, the treatment of depression or for a particular psych disorder. It's just, it has to be something that's done in collaboration.
Yeah. This says, I do a lot of multitasking during the workday, sometimes bringing work home, which then also often increases stress levels. It takes me hours to wind down after coming home. I don't often sleep well. I have tried new routines, but then a new project comes up. Do you have any recommendations? This is tough because it goes back to like, we're a society that thinks work has to be the number one priority.
Yeah.
Like, we've been brainwashed into thinking that like work has to be like, it is crazy. We literally like, oh, you have to leave to go to your child's Christmas play. Yes. They're human. Like, yes, we do. It is crazy that people got away with that for so long. Right. So that to me is about people feeling like bad that they're not working hard enough, even though they're working too much.
I know. And I can sympathize with that. Being a mom, being a physician, I always have extra work on top of what I have to do. I really think that we need to change as a society as a whole. And the better we educate each other and sort of our proponents for each other and say, this is important. You know, I can't tell you to get a new job. I mean, that would be the solution, right? Get rid of the work projects, get a new job, try to find something that doesn't take away that time. Because otherwise it's going to be extremely difficult to fix the problem. And you unfortunately then have to go into knowing it that, you know, work projects that create stress are going to lead to less sleep, which is not healthy for me overall. So it really comes down to, unfortunately, trying to once again find a balance, right? Finding, using time to sort of set limits and saying my work can't be beyond a certain pace and that it just has to be done the next day. And that prioritizing yourself is equally important.
And then consider putting a hard stop on your evening, right? So if you bring home work, if you're someone that was like, I just have to get this work done, decide that you can do some work up until 9 o'clock. And at 9 o'clock, that's your time, right? That's when when work stops and you start unwinding for the evening, getting ready for bed, and whatever is left will just have to be done tomorrow. And I think it comes back to committing to the process, just like Nicole was saying earlier, where it will feel weird at first. So it'll be uncomfortable. Like I have all this work to do, but I'm not doing it after this time. But you'll train yourself, right, to be comfortable with that idea that I deserve some time for myself. And yes, work is important. It's important for all of us, but you also need to prioritize your health and yourself, because that's what you're really investing in when you make those kind of decisions and commit to that process.
Yeah. And that job isn't going to care about you, you know, like you have to
long term. No.
Yeah.
How are you going to love anybody else if you don't love your damn self, right?
Very true.
Two quick questions. One is, I sleep 10 hours. I'm still sleepy. And then the other one is pillows and like back sleeping versus side sleeping. I don't, you know, I'm a side sleeper. I don't want to talk about it, but I can't help it because I know they say you're supposed to sleep on your back. It's supposed to be like the best way. But so yeah, so the sleeping the 10 hours and feeling tired when you wake up, and then like pillows and sleep position. And then, oh my God, we're almost done.
Yeah. So sleeping 10 hours, you just want to make sure that you don't have any other sleep disorder that is changing the quality of your sleep. So that's requiring you to get more sleep than you should be. It also depends how old you are. I mean, there are upper limits of normal. That's kind of going back to that idiopathic hypersomnia question. So if you've ruled out other sleep disorders and then you want to get checked specifically for sleepiness during the day or the requirement or need for increased sleep, then that's what I would recommend. As for your question about the pillows, actually sleeping on your back is not the end all be all, because sleep apnea on your back actually tends to be worse in most patients. So sleeping on your side versus sleeping on your back, actually whichever way that you get the best quality of sleep is what I recommend.
Agreed. And for heart health, there's no difference as far as which way you sleep in the bed. So whatever gets you to 9 hours.
My physical therapist is like, I'm like, I hug the pillow and sleep on my side, like this, like a little go. And I'm like, why does my shoulder hurt? I don't know. I don't want to sleep on my back.
They're the ones telling you to sleep on your back. Exactly.
Okay, do you know that I talked to 2 doctors from Harvard and Tufts, like the 2 top programs in the country, and they said it doesn't matter. Okay. All right. So from both of you, before we wrap up, is there any advice or closing statements that you would like to say regarding this issue and health and overall well-being?
I think take your sleep seriously. I mean, take your health seriously. We talked a lot about heart health and the effect of a lack of sleep or sleep apnea or other sleep disorders. But it also can affect your overall health for multiple different body functions and organ functions. And we talked a little bit about cognition and, how you think mentally during the day. So it is important to prioritize yourself. It's important to prioritize your sleep. And if you're not getting a good quality of sleep, seek out help, seek out an evaluation, come see us in the office, because you never know what you may uncover and how you can actually help yourself.
And I think I agree with everything that you said. And I would say that sleep, it's something that I feel a lot of us don't prioritize, but hopefully after you've listened to this and you've been listening in for the past hour, you'll see that yes, it's something that we all do, but it's actually really important. And I would say that everyone that is having trouble sleeping should kind of come up with an action plan for what are they going to do differently to help improve their sleep health. And if it means talking to someone about it, talking to your primary care physician, your cardiologist, if you're someone that snores, saying like next time you see your primary care doctor, ask them, hey, I snore a lot. I listened to this talk and they said I may have sleep apnea. Should I get screened for this, right? Or I'm having these other symptoms that we discussed. Should I get screened for sleep apnea? I would say that you are the one person that's going to take the best care of you. And so sleep is important. And I think just making sure, finding a way to work adequate amounts of sleep, in addition to all the other things that are good for your heart, into your day, would be the big message I have for you.
That's awesome. And one thing, Valerie said something really important. She says that she works from home and she does not allow her computer in her bedroom. That is strictly taboo for me. And I think that that's something that people don't realize. Like, have your bedroom a sanctuary.
Yes.
Get beautiful comforters,
Yes.
invested. People like, I can't spend $200 for sheets. And obviously maybe $200 is a lot, but like, you're sleeping in it every night.
Yes.
Paint the color that you love, right? Like
Yes.
just make your bedroom a sanctuary so that you know that you're going to feel good when you go into it. I don't think people prioritize that enough, and it really does matter.
They don't. Use your bed just as a place to sleep and have sex, but don't use it for other things,
Yeah. We're very sex positive here at Virtua. Did a whole panel on that too. I was like, ladies, get it in. Right? All right. Thank you so much. It's your body. And if it's not functioning the way you want, I was like, what happened? There is help, and this is why Virtua is so amazing. A recording of this session will be emailed to you in the next week. And if you would like to schedule an appointment, I did see some questions coming in. How to schedule an appointment? Who could I reach out to with a virtual heart specialist? You can visit virtua.org/consult, which you see our amazing pulmonary and sleep medicine specialists. There's the phone number right there. So much information on the website. So never be afraid to ask a question. There's no dumb question when it comes to your health, making yourself and your family's health a priority. Thank you so much. This was an awesome, and thank you to our incredible doctors. They're just so smart, and I love smart people, so especially women. So thank you.
Thank you, Nicole. This was great.
Thank you.
Thanks for having us.
Thank you, Nicole. Thanks for having us.
Have a great rest of your week.